David again with O2 Performance and Recovery. Want to show you what a session looks like, an IHHT or IHC session looks like. Intermittent Hypoxic Hyperoxic Training or Conditioning. So here's our setup here that we have. So this is actually the mechanism that we use. It's got the oxygen. The high oxygen is up here, and here at the top, enriched anywhere from 60 to 80%. And then down here at the bottom, this is the lower level oxygen, right? So this is what takes to hypoxia. This can be anywhere from 15 down to 9%. So you're either breathing out of one or the other. We have a mask that goes on via this hose right here. So we have a control app here, and on the app, when we're on this setting, which is the mountain, we're always breathing out of the lower level of oxygen down here, lower part of the bag. And then when we switch it here, you hear the switch, then it goes up and you're breathing out of the top part for the enriched oxygen, right? So it's back and forth. So we control that through the switch here. So this bike, usually this is our more aggressive way that we do it. So anybody doing performance recovery, somebody who's doing more of the exercise portion of it, who wants to get after it, will use this bike. Most people will use this. We also have this over here, which is our recumbent bike. So a lot of our older folks or people who have balance issues will do this. And then we also have the option for a chair. So someone who doesn't want to do either one of these or maybe has an injury, we can sit in a chair and do different types of exercises and breathing techniques. So the different types of people that we have here, of course, we have our really competitive athletes, work with a lot of different athletes in that respect, not just here, but different other places around the country. And they're definitely going to be using this. And the athletes are using it for performance and to speed up recovery. That's their main goal, to do this while they're doing this. And then a lot of the older kind of middle-aged people that are dealing with anything from neuropathy, dealing with brain fog, sometimes early dementia, COPD, breathing issues, really effective for that. So anyone that's dealing with any kind of chronic type condition would probably be using this one. Sometimes this one is here, which sort of slow it down for them. And then the other type of person, someone who has an injury, who maybe can't get on these, will do it in a chair, maybe even standing up. So we have lots of different folks. We have a 90-year-old, 85-year-old, 78-year-old, and then we have as young as teenagers. So we kind of run the gamut of who we work with here. So thanks for joining us again, David, O2 Performance and Recovery.